Everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing an antidepressant medication that's classified as an SSRI. Its name is Paroxetine. Its brand name is Paxil. Before we talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source of recommendations for your personal health care. As I mentioned, Paroxetine is classified as an SSRI, which stands for Selective Serotonin Reuptake Inhibitor. I do believe this is the last one of this class that we'll be covering. If you're interested in checking out videos on other SSRIs, just check back in the medication list. So depression would be the most common use of Paroxetine. However, there are some other indications where it's used as well, so I'll go over some of those for you now. So besides regular MDD, major depressive disorder, it can also be used for recurrent MDD as well as for prophylaxis of MDD. It can be used to treat the depressed phase in bipolar disorder as long as there's an anti-manic agent on board. It is indicated for obsessive compulsive disorder or OCD. It can be used in panic disorder with or without agoraphobia. Paroxetine can be used in social anxiety disorder as well as post-traumatic stress disorder or PTSD. Paxil can be used to treat premenstrual dysphoric disorder. It can be used in generalized anxiety disorder as well as dysthymia. And you may also see it used in postpartum depression. The exact mechanism of action of SSRIs is unknown. However, through the inhibition of uptake of serotonin, it does cause an increase in serotonin concentrations in the synapse, which causes a downregulation of postsynaptic receptors. One example of these receptors would be the 5-HT2A receptor. Now, before somebody was to use Paroxetine or Paxil, there are some precautions or warnings that they should be made aware of. First is that all patients who are starting these types of medications must be monitored closely for any signs of worsening of depression as well as the appearance of suicidal ideation. These thoughts are more common in younger individuals, however can happen in any population, especially when there's a change in dose, whether that be an increase in dose or a decrease in dose. SSRIs in general may impair a patient's ability to perform hazardous tasks, such as operating heavy machinery or driving an automobile, so the best practice would be not to perform these tasks until the patient has an understanding of how the medication makes them feel. Because Paroxetine does affect serotonin levels, if somebody was using this medication with other medications that also affect serotonin levels, this could put the patient at an increased risk of experiencing serotonin syndrome. Paroxetine is one of the 3 SSRIs that can displace highly protein-bound medications. So if you're using a medication that is highly protein-bound, you can expect higher plasma concentrations of that medication. Paroxetine is also one of the SSRIs that does have an effect on the cytochrome P450 system, so this can cause a problem with certain medications in terms of drug interactions. And finally, as a rule of thumb, we generally try to give the lowest possible effective dose to individuals who have kidney and liver problems. Now, once somebody is made aware of the warnings and precautions associated with Paxil and start using the medication, they can expect to start taking the medication really in many different forms. It's available in tablet form in 10, 20, 30, and 40 milligram. There's an oral suspension that comes in at a strength of 5 milligrams per 5 ml. There are controlled release tablets that come in at strengths of 12.5 milligrams, 25 milligrams, as well as 37.5 milligrams. And there's also a brand name Paxil that has a different salt in the tablets, but again, these tablets would still be 10, 20, 30, and 40 milligram. In terms of dosing, the only rule of thumb here is that you would start off on a low dose and slowly increase that dose over time. Upon initiation, you would typically stay on the initial dose for 1 to 2 weeks just to make sure that you have reached steady state before you start increasing the medication. Your physician and pharmacist will help you come up with a plan of how to increase the medication appropriately. One thing that should be noted, especially upon initiation of therapy, is that these types of medications do take some time to work. It can take anywhere from weeks till months before you notice the maximum benefit from the medication. Unfortunately, when people start the medication, they may experience side effects, but not much benefit. Many of these patients would stop taking the medication unless they're made aware that they do have to push through that period of time and get to the point where they can actually have a chance of experiencing max benefit. Now, as with all medications, there are some adverse reactions or side effects that individuals may experience while using Paroxetine, so I'll list some of those here for you now. Some people that use Paroxetine notice drowsiness or sedation, while others experience insomnia. Both of these side effects come in at a rate of over 10%. Over 2% of people may experience a feeling of excitement or even hypomania, and less than 2% experience disorientation or confusion. Headaches happen as well in about 10% of people. Some people may experience anticholinergic side effects while using Paxil, such as dry mouth, urinary retention, constipation, or sweating. Of these side effects, dry mouth, constipation, and sweating happen about 10% of the time, while the other anticholinergic side effects happen about 2% of the time. 10% of people using this medication may experience extrapyramidal side effects, such as a tremor. More than 10% of patients may experience orthostatic hypotension, and a small amount may notice a change on an ECG, or arrhythmia, or tachycardia. Paroxetine seems to be a little bit better on the gut compared to other SSRIs, with GI distress only coming in at 10%, as we've seen with other SSRIs that it happens in 30% occasionally. Over 10% of people do notice weight gain with paroxetine, and unfortunately over 30% of people experience sexual disturbances. That's all we're going to talk about today with paroxetine or Paxil. As always, I'm thankful that you took time. That's all we're going to talk about today with paroxetine or Paxil. As always, I'm thankful that you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help me grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.